topical and the main set of questions. So we now move on to the Minister of Health. It's your first day, so your standard has been set. And I call Paula Bradshaw. Minister.
I hope to rise to the challenge. I thank the member for her question. The report of the Independent Review of Children's Social Care Services was published in June of last year. It was followed by a public consultation on the review recommendations. That ran for 12 weeks from September to December 2023, and my officials are currently in the process of developing advice based on analysis of the responses to that public consultation. Subject to the final outcome to consultation and other factors, including the availability of budget, of course, and the views of other ministers where relevant because of cross-cutting issues, the intention would be to implement as many recommendations as quickly as possible. A number of those recommendations will be taken forward through the Children's Social Care Services Reform Programme as appropriate.
Ms Bradshaw.
Thank you, Mr Speaker, and thank you, Health Minister. Last week I was speaking to a senior social worker in the Northern Trust, and she said that she very much feels under a lot of pressure and almost like they're a second-class workforce. What measures are you taking in the short term to better support and bolster the social work community? Thank you.
Minister.
And again, I thank the member for the follow-up. I do accept that working in children's social care services does require fully staffed, well-motivated and well-managed teams of social workers and indeed other staff. Work to identify measures to address the issues in the social care workforce is ongoing. It's under the Workforce Review Implementation Board and the Children's Social Care Services Strategic Reform Programme. Under the Reform Programme, a social care workforce workstream has been established, an exercise to scope the existing social care workforce, and work in relation to a social care workforce strategy has also commenced. In addition, a number of actions have already been taken aimed at stabilising the social work workforce. This includes fast-tracking the employment of newly qualified social workers and the cessation of recruitment of social workers through recruitment agencies. Work relating to the development of a 10-year plan relating to pathways into social work is well advanced, and this plan aims to maximise attraction into the social work profession, outline the most efficient recruitment processes, and describe effective retention strategies to maintain social workers in essential health and social care services. Funding, finally, has been secured to commission an additional 40 social work training places, and these are expected to commence in September of this year.
Liz Kimmins.
The Minister for his answers thus far, and the Minister will be aware that we had Professor Ray Jones in at the Health Committee last week to brief on the review, and he expressed some of his concerns and frustrations around the pace at which the implementation of the recommendations are happening. Can the Minister therefore assure us that he will take the decisions needed to move this on as quickly as possible before more and more children end up in care in which could have been avoided?
Minister.
I thank the Chair for her comments and her question. I was aware that Professor Jones was in front of the committee last Thursday, and in fact he was good enough on his way back to the airport to drive by Castle Buildings, and I was able to just have a very brief introductory conversation with him. Woke up this morning to find a very encouraging email from the Professor, so I very much look forward to engaging with him in the immediate future. I think these are really important issues. Some of the recommendations, of course, are cross-cutting and actually, to my mind, potentially repercussive. So I want to give due considerations, not just to what he's proposing and how it impacts on children's services, but also how it might impact on other areas. So, for example, his recommendation for an arm's-length body is potentially repercussive. And I'm not saying that is a bad thing. I'm just saying we need to be aware of what those repercussions are, and that will mean having a discussion with executive colleagues.
Colin McGrath.
One of the best involvements that children can have with social services is no involvement, because it's not required. And when we asked that question of Professor Jones last week, he cited things such as the two-child benefit cap and the lack of a poverty strategy as being contributors to the conditions that mean children will require involvement of social services. What work is the Minister doing with other executive colleagues to try and prevent poverty and enable children to stay away from social services?
I thank the member for his question. He will be aware that I'm less than 2 weeks in post, and as yet there's yet to be an executive meeting during my time as Health Minister, though I hope that will be rectified, or that will cease to be the case this week on Thursday. What I would say to the member is that I have identified some of the areas which I consider the most difficult or challenging within health and social care, and these are areas that I want to concentrate on over the next 3 years, and that includes waiting lists, cancer, mental health, and health inequalities. And I think it is in the area of health inequalities that we need to see cross-cutting actions taken by the Executive, and I think that will address where the member is directing me.
Paul Fruit.
Mr. Speaker, question number 3.
Minister.
I thank the member for his question. The Health and Social Care COVID certification scheme was introduced at the start of July 2021. This was to enable Northern Ireland citizens who wish to undertake international travel to satisfy the requirements of the destination countries. Without the service, citizens would have been unable to avoid restrictions such as a 10-day quarantine on arrival, which was imposed by other countries. The service closed to new applications on the 19th of December 2023, when the last remaining countries withdrew their requirements for vaccination certification. Between July 2021 and December 23, the COVID certification scheme in Northern Ireland cost a total of £21.5 million. This funding covered the creation and use of a civil service identity authentication service, the creation and maintenance of an internationally trusted mobile app and paper certificates, and the provision of a helpline to assist those experiencing difficulties with automated process and provide assistance with obtaining secure paper certificates, and indeed providing further guidance. Had the service not been available, patients would have inundated GPs and vaccination centres with requests for documentation to undertake international travel. In November 21, the Executive also agreed restrictions on access to a range of venues. Northern Ireland citizens were able to use the COVID Cert app to meet criteria for access. The creation and maintenance of the service helped allow continued access to a range of businesses during the pandemic.
Mr. Frey.
Thank you, Mr. Speaker, and I thank the Minister for his answer. Given the fact that the vaccine certification scheme was used to coerce and discriminate against people to take a medicine that could cause them serious side effects, making them very sick, some people having lost family due to vaccine injury, will the Health Minister acknowledge that some people have had their lives destroyed, and will he commit to meet the vaccine injured and bereaved community, something his predecessor refused to do?
Minister.
I thank the member, and I acknowledge his long-standing interest in all these issues. Personally, I have absolutely no difficulty in saying I will meet members of that group. I think it is very important for me to understand their viewpoint, but I think it's also important for the member to understand that this was effectively an unprecedented time for the devolved administration, and decisions were to be made at pace. I would regret utterly and absolutely any damage that was caused because of a vaccination programme to any citizen in this country. I think that is the last thing any member of this House would do. But I would also encourage the member to understand that there had to be a balance struck here. For example, in terms of the cost of the certification scheme he asked about, you've got to balance the cost of that against the almost certain chaos that not introducing such a scheme may have caused.
Honourable McMurray.
And thank you to the Minister. Can the Minister provide an update on progress towards the introduction of the Public Health Bill?
Yes, I thank the member for his question. The public health bill is something that I have been discussing in my early days. We are currently governed by a bill, or an act, I beg his pardon, an act dating from 1967. And it seems to me that that act is all well and good if the issue is noted on the face of the bill. But if it isn't, then there is a problem. And so I am now in the early stages of taking briefings with colleagues about introducing a new bill which will be effectively something that looks at all hazards, covering all hazards, so that we can be much fleeter of foot, but it is something that will obviously require a cross-departmental agreement at the executive level. And I would be keen that any regulations that may be contained in such a bill would be subject to affirmative action. In other words, that this House and the members of this Assembly will very much have their place in making the final decisions.
Mark Durkan.
Question number 4.
Minister.
I thank the member. The soft drinks industry levy is a UK-wide tariff. It applies to drinks that contain added sugar, and it seeks to contribute to strategies to reduce obesity by reducing or removing added sugar from soft drinks, encouraging producers and importers to reformulate their products to reduce the sugar content and/or reduce portion sizes for added sugar drinks. Given the nature of the market and the fact the levy applies to producers and importers, this means these businesses are reporting once for all receipts raised across the UK. Therefore, HMRC does not report receipts below the UK-wide level or regionally. However, in 22-23, the levy raised £355 million across the UK, and using population measure and assuming production of soft drinks is representative across the UK, we could estimate that 10.6 million was raised in Northern Ireland in financial year 22-23. The levy is not formally linked by the UK government to any specific spending, and therefore it's not known how much the executive receives as a result of the levy. My department previously explored the potential to use funds equivalent to those likely to have been raised through the levy in Northern Ireland for tackling obesity and other public health related issues, but given there was no budget line, this did not prove to be possible. It would still be my preference that the revenue raised through the levy would be targeted at obesity-related purposes. My department recently consulted on a new co-produced obesity strategy framework, Healthy Futures. The public consultation commenced on the 24th of November last and closed on the 1st of March this year. A consultation summary report has been developed, and the department will give further consideration for the potential to use resources such as the soft drinks industry levy and the mechanisms to do so as work on the new strategic framework progresses.
Mr. Durkan.
Thank you, Mr. Speaker. I'd also like to congratulate the Minister and wish him well on his elevation from frying pan to fire. I don't doubt his desire to do things differently if it means improving outcomes for people primarily, but also for the public purse. And in that vein, does the Minister concur, therefore, that increased targeted spend on prevention and an early intervention will dramatically reduce suffering due to conditions and spend associated with obesity?
Minister.
I absolutely do agree with the member. Currently, for example, if we talk about treatments for obesity or the cost of treatment for obesity, I have my department giving further consideration for the potential to use resources such as this levy and to the mechanisms to do so through the development of priorities and actions arising from the strategic framework. And officials are in contact with the Department of Finance, and a consultation summary report will be published soon. I agree with the member. This is a critical issue. Public health is just so important, and we spend a lot on it, but we think about the savings. I'm very much believing in data as a way forward, but also conscious that all data ultimately responds to human or equates to human beings, and it's the human cost of things like obesity that we have to tackle.
Cheryl Brownlee.
also welcome the Minister to his new position. Minister, if you could provide an update on funding for the commission of the hybrid closed-loop technology for people with type 1 diabetes, especially in light of the very positive announcement from our Scottish Government. Thank you.
Minister.
Well, I thank the member for her question. I'm not entirely sure that actually relates to the original question, Mr. Speaker, but what I can say is the Strategic Planning and Performance Group received formal notification of endorsement from the Department of Health following the review of the NICE final guidance on hybrid closed-loop systems for managing blood glucose levels in type 1 diabetes, which was published in December of 2023. So work is being undertaken to understand the implications of this decision in terms of overall provision, consideration of priority groups, system costs, workforce and communication requirements to both enable and support, and this will inform final decision-making and commissioning arrangements for Northern Ireland. It may be interesting for the member to note it's worth that NHS England has developed a phased implementation strategy. This is over a 5-year period in response to the guidance owing to the scale and scope of this recommendation. This also includes a process of prioritisation on eligibility in line with NICE guidelines. Significant additional investment will be required to support the implementation of the hybrid closed-loop system to people living with type 1 diabetes who would be eligible. The Northern Ireland Diabetics Network will communicate with all stakeholders following decision-making in relation to hybrid closed-loop systems and its implementation in Northern Ireland.
Can the Minister provide an insight as to what is behind the very significant growth in people living now with type 2 diabetes, Minister?
I thank the member for his question. I think there are a variety of factors that impact the growth of type 2 diabetes, and this is something that we all need to be focused on because its implications in terms of health for individuals, communities, but also in terms of the resource and funding of the health service cannot be overestimated. So factors include age, ethnicity, but above all, there are manageable issues, and the biggest one of all, of course, is that of diet. And one of the issues that I have been discussing at an early stage with colleagues and officials in the Department of Health in terms of my desire to bring forward an initiative in terms of health inequalities is looking at diet and the role that dietitians can play if we are going to get ourselves out of the buildings we call GP surgeries and hospitals and take services into the community.
Minister.
I thank the member for his question. The Department will be publishing comprehensive data relating to abortions in Northern Ireland on the 20th of June this year. This will cover the 3-year period from the introduction of the Abortion Northern Ireland No. 2 regulations on the 31st of March 2020 up to the 31st of March 2023. My understanding is that the Department's annual publications had underreported the number of abortions in Northern Ireland since the law was changed in 2020. This is recognised, and although the accurate totals had been disclosed regularly through written Assembly questions, I can assure the member that this will be corrected in the forthcoming publication for each of the 3 reporting years. Now, the issue arose because the methodology in place prior to the law change was set up to capture only those procedures involving hospital admissions. However, since the introduction of the 2020 abortion regulations, the majority of abortions in Northern Ireland are early medical abortions and take place in an outpatient setting. Following the instruction from the Secretary of State for Northern Ireland to the Department on the 2nd of December 2022 to formally commission abortion services, a process has been underway to verify up-to-date statistics from the date of law change in Northern Ireland. These are the statistics that will be published later this month.
Mr. Alistair.
It's concerning to hear of the underreporting, considering there's been 8,000 reported in the figures already. But in terms of the data that will be published, can the Minister assure me that we will now see the sort of data we see from England and Wales, indicating the age of the mother, the cause, the medical cause in England and Wales is published, whether it was related to Down syndrome or spina bifida or something else, and all of those things, will they now appear? Because it's important that people know how many babies with spina bifida or with Down syndrome are in fact being killed in the womb.
Minister.
Mr. Speaker, I can assure the member of this, as is the case in England and Wales and in Scotland for all their abortion publications, the forthcoming publication for abortions here in Northern Ireland will provide a breakdown of abortions. It will be done by age, by Health and Social Care Trust, by the statutory grounds for abortion, which will be based on the Abortion Northern Ireland No. 2 regulations of 2020, by gestation and by method of abortion.
Connie Egan.
Minister, do you have any plans to bring abortion services in Northern Ireland into line with England, Scotland and Wales by fulfilling Section 8 of the Abortion No. 2 Regulations 2020 regarding telemedicine?
Minister.
I thank the member for her question. Unfortunately, as I say, being just under 2 weeks into the role, there are some areas that I have not yet had the opportunity to have a detailed briefing upon from senior officials in the Department of Health, or indeed on occasions from arm's length bodies, from some of the Royal Colleges or the British Medical Association. So I'm not actually, I'm afraid, in a position to make a definitive statement to the member on that issue. But she has put it on my radar, and I will consult, reflect and decide in due course.
Candour.
Number 6.
Minister.
I thank the member for her question. Reform of our Health and Social Care Service is one of my key concerns. I made clear in my opening statement last Monday that it was an area that I would be focusing on, along with health inequalities, cancer, mental health and waiting lists. Already there is an existing overarching plan for reforming our health service. The Health and Wellbeing 2026 Delivering Together report was launched in 2016 as the Department's 10-year plan in response to the recommendation of the Bengoa report, Systems Not Structures, Changing Health and Social Care. And of course we need to continue to review and refine this 10-year Delivering Together plan. Progress has been made across a broad range of critical areas, including social care, mental health, acute care, elective care and primary care. For example, in primary care, we've rolled out the multidisciplinary team model, which is not only providing a better service for patients, but also helps to stabilise GP practices. In elective care, we've established day procedure centres at Lagan Valley and Omagh hospitals, and overnight stay centres at the Mater, Daisy Hill and South West Acute. Now this is beginning to deliver some welcome results. The latest inpatient and day case stats show a reduction for the 7th successive quarter, and that's the longest sustained reduction since at least 2008. And that, Mr. Speaker, I offer as a fact, not as complacency. There are important examples of reform in action. Reform continues to be progressed through co-production and collaborative working with a wide range of stakeholders. And my department has in the past published a number of Delivering Together update reports highlighting the progress that's been made on various reform projects. The Delivering Together 2024 Progress Report, which summarises all the current health and social care reform strategies and plans, will shortly be available for publication.
Ms. Dodds.
Thank you, Mr. Speaker. It is unfortunate at a time when we know that the health service needs significant reform in order to provide better outcomes for patients, that we've really got a history of what has happened from 2016 from the Minister. Can I pick up one point, Minister, out of many I could have picked up from your answer in relation to multidisciplinary teams? These teams were set up initially as consequences of supply money from the DUP Conference and Supply Agreement. So far, only 30%.
Question, please, Mrs. Dodds.
Only 30% of GP practices have them, and only 8% have full multidisciplinary services. When do you rectify this, and do you acknowledge that this is fundamental to transformation?
Minister.
Well, Mr. Speaker, the irony is not lost on me that the member criticises me for giving a history of events in 2016 and then gives the House a history of her party's confidence and supply arrangements. The multidisciplinary teams, I repeat, on an evidence base are working. They're working very well. They're delivering what I want. Everything I focus on is for better outcomes. They are delivering them. The rollout was a multi-year plan. Unfortunately, under the current budget, that plan will not be speeded up. It will slow down. And so I look forward to meeting with executive colleagues to try and impress upon them some of the issues that are related to the current budget for the Department of Health and seeing what we can do. Because I want to do what I can with the money we've got. It is a lot of money, but the pressures remain. And one of the pressures is the inability to deliver in a timely manner, as I would wish, the rollout of multidisciplinary teams.
And thank the Minister for your answers so far. Minister, can you give us assurance, the previous Minister did give assurances that every single inch of the hospitals and the buildings that we have are needed. Can you give us assurances that you will bring both staff and the community with you whenever you're looking at where services will be delivered? Because we need all the hospitals, but we need to know where the service is going to be.
Minister.
Mr. Speaker, I agree wholeheartedly with the member. As my predecessor said, we need every square metre is a square inch. I'm not sure whether he's being European or not, but we do need every single amount that we've got in those buildings. But what I want to do is put a focus on the people who populate those buildings. As I said last Monday, I think the two reasons we have a health service primarily are to keep the healthy, but also to cure the sick. And no matter how much resource we have for keeping people healthy, we will still find that people become sick. They will still need to go places where they will find specialists who are dedicated to curing whatever ailment that they present with. So yes, we will be looking at our entire estate of hospitals, and I hope sooner rather than later to be speaking to the House about how we better view each hospital as part of a network rather than an institution operating in isolation. And so not every hospital will provide every service. And again, as I think I said on Monday, if I needed a procedure and the choice was to go to the nearest facility where they only do the procedure, say, once a week, or travel a bit further to get to somewhere where they do it 7 times a day, 5 days a week, and I know which one I'm going to be choosing. So it's a question of reorganising and it's a question of reforming, but it's not a question of saying, I am closing a hospital. I have no intention over the next 3 years of going anywhere near the idea of closing a hospital or reducing that square meterage or square yardage.
Donny Donnelly.
And thanks to the Minister for his answer so far. The Minister had mentioned his commitment to the Bangor report. We'll all know that due to repeated shutdowns in this place, we should have been 8 years into a 10-year programme of reform within the health service. Can the Minister outline his priorities in respect of transformation over the remainder of this mandate?
Minister.
And I thank the Deputy Chair for his question. I think what we perhaps need, given we are so far away from the publication of the Bangor report, is to get back to day zero, perhaps to reboot, almost return to factory settings, to use that sort of a cliche. And I have been discussing with senior officials in the department how we might actually reboot, because it seems to me Bangor has perhaps, in part of the public consciousness, been misinterpreted, that it's now viewed as some sort of roadmap or blueprint for how we get from where we are to the best possible 21st century health and social care service that we can devise. And of course it wasn't. What it was a set of principles, or perhaps we could call it a framework, but it is up to us, it is up to stakeholders to populate that framework and to make it work in the best possible way. So I am thinking about it. I would hope to be able to return to the House, if not before recess, certainly early in the autumn, with an idea about how we go about rebooting Bengoa and actually delivering it in a practical sense, delivering the principles in a real-time sense.
The time has lapsed for questions. We now move to topical questions. And the first member on the list for topicals is Colin McGrath.
Speaker, can I ask what steps the Minister has taken to publish data on the number of people living in each trust area with the various types of dementia?
Minister.
Well, I thank the member for his question, and obviously dementia is an issue that is so broad and impacts so deeply on so many people. And earlier today, upstairs, I'm sure the member popped into the Parkinson's. I know his colleague sitting behind him, Mr McGlone, was there as well. And if I may just divert for a second and put on record, as I did upstairs, my thanks to the thousands and thousands of carers, particularly unpaid carers, who provide such fantastic work to us in the country. In terms of breaking down numbers across the various geographic health trusts, I'm not sure if that's been done, to be frank, to the member, and I will certainly go away and make it my business to find out. I think, as I've said previously, data is absolutely key to maximising the resources and the capacity of the health and social care system to deliver for patients.
Okay, Mr McGrath.
Thank the Minister, because there are new modifying therapies that are awaiting approval, but obviously some of it is very beneficial to those with early stage of Alzheimer's and not other forms. So therefore, having that data, understanding that data is absolutely critical to the early intervention, which will help to enable people to live with the condition for longer. So would the Minister agree with me that getting that early diagnosis is crucial in helping people?
Mr.
I certainly would. I think, first of all, awareness and education, and then early detection and prevention. These things all go together. And social prescribing is something that is relatively new in terms of health and social care. And I think that is very important. I mean, I know I do puzzles, I do crosswords to try and keep myself mentally fit. My dear late mother, when she was alive, even in her 80s, liked to do things like Wordle. She used to, in fact, when the glider came on stream in East Belfast, she used to get the glider into town to go for a cup of coffee, because she felt that kept herself active and mentally stimulated. So there's a lot of things outside of pills and tablets that we have to look to in order to address these issues. I was going to say tackle these issues. It's not going to go away, but it's a question of handling it to best effect. And yes, awareness, education, early detection, absolutely critical.
Good, Nicole.
Mr. Speaker, and thank you, Minister. I wish you well in your new role. On the back of the Routes to Diagnosis report, which showed that 28% of bowel cancers are detected in emergency settings, of which half are diagnosed as stage 4, as well as showing a significant drop in emergency presentation among the screening population, does the Minister have any plans to reduce the bowel screening age to 50 in line with the UK National Screening Committee recommendations?
Sir.
I thank the member, and perhaps we should be swapping places for this one, because you have a level of detail which I'm afraid I cannot match on this first day of topical questions. But what I would say to her is that cancer is one of the 4 areas that I identified, along with mental health, waiting lists and health inequalities, as something that I really want to focus on in the remaining 3 years of the mandate. And in terms of being the Minister, in terms of having a leadership role, what I think is very important is to surround yourself with the people who know the things you don't. And clearly, for example, you have an expertise and an interest in this particular area, which I will take back to the relevant staff within the Department of Health and the arm's length bodies and the other stakeholders as required. And we'll look at this, and I promise I will once again study it, reflect on it, make a decision and get back to you in due course.
Ms. Nigel.
Thank you, Mr. Speaker, and thank you, Minister, for your answer. Just to add then a supplementary to that, if you're going to be engaging with officials, then I'd urge you to engage with campaigners who are campaigning around bowel cancer, and they are the ones with the expertise, not me, and they'd be happy to brief you to a further level. Thank you.
Minister.
I take the point.
Okay, thank you. Move on to...
Minister, I submitted a written question there and got a response last week. I had asked about, in the face of the mental health crisis in Northern Ireland, could the Minister detail the number of patients that were directly referred into voluntary community sector organisations? And the response was that requests were sent to Health and Social Care Trust for them to respond that the information wasn't available. I was disappointed that that didn't have any follow-up commitment on it, and I would ask that the Minister consider whether there should be a further review to access and audit that information.
Minister.
I thank the member, and I'm disappointed that she is not satisfied with the response she would get. As a broad point, what I would say is that the health and social care system, and then when you include the voluntary and community sector and the charities, it's a vast, very, very complex set of institutions and bodies, and there are an awful lot of moving parts. So I am aware sometimes when a member asks a written question of me, that I have to say that the information is held by the Health and Social Care Trust rather than the department, and sometimes the Health and Social Care Trusts are able to provide the information, and sometimes they come back and say they don't hold the information. As I've already said on a couple of occasions in this session, data is going to be very important to me in terms of how we improve and max out the capacity of the entire system. So where there are gaps, I need to know about them, I need to react to them, and so I thank the member for putting that on my radar, and I will take it away, and I will ask questions about why you remain unsatisfied and why we cannot satisfy your desire.
Thank you, Mr. Speaker, and I am pleased to chair the recently formed all-party group on voluntary community sector, and there's a real feeling within the sector that it is not valued in terms of the recognition, in terms of outcomes by the departments, and I would invite the Minister to engage with the all-party group and perhaps attend an upcoming meeting to satisfy them as to his recognition of their value in this term.
Minister.
Well, I thank the member. I must caution there are so many all-party groups. I'm not sure it is going to be actually just logistically possible for members of the executive, for executive ministers to start engaging across that whole sector. I have sat on a number of all-party groups, so I very much recognise their importance. I do believe it is also important that the right officials from departments attend all-party groups when it is relevant. For example, the all-party group on social enterprise, which I was very fond of sitting on, back in the day as the Permanent Secretary of the Department of Finance, Sue Gray, was a regular attender at these things. So I think there is a way of better coordinating engagement between all-party groups and departments at a very, very senior level. What I would also say to the member is, thinking back to my experience as a Victims Commissioner at the Commission for Victims and Survivors, you had maybe 100 groups that were set up to help some of the most vulnerable people who had been hurt in the course of the conflict, both physically and mentally. And the people who were running those groups, they didn't set them up to be chief executives or to be accountants or to be human resource managers. And yet they seem to spend a lot of the time doing that. They spent a very significant amount of their time chasing funds to keep their bodies running on an annual basis. So I'm very interested in how better we support the voluntary and community sector and effectively free them up to do what they set themselves up to do, which is to help vulnerable people.
Can the Minister tell us if he has any plans to introduce an individual duty of candour, which was one of the key recommendations from Justice O'Hara's inquiry into the hyponatremia scandal?
Minister.
I thank the member for his question, and this is something which I have been discussing with officials in the first 2 weeks. The member will be aware there was a public consultation in 2022 on a duty of candour. And my officials are now developing proposals for a regional being open framework, and that includes plans for further consultations in the months ahead. This is a key contributing piece of work to help further support an open, just and learning culture in health and social care. I'm aware that DHSC in England is reviewing the implementation of the duty of candour in England, and we will of course consider the learning emerging from that exercise.
Mr. Sheehan.
Thank the Minister for his answer. The Minister will be aware that there have been a number of scandals in the health service over the last number of years, as well as hyponatremia. We've had the Mucklemore debacle, we've had the blood contamination scandal, and of course in urology and the Belfast Trust. And one of the common themes running through all of these scandals is the lack of accountability and the circling of the wagons to protect organisational reputations. And can the Minister tell me, is he going to introduce an individual duty of candour, or is he going to cop out and go with an organisational duty of candour?
Minister.
I thank the member, but I am not going to agree with his description of copping out. What I'm interested in is how best we encourage individuals working in health and social care to be absolutely honest about what happens when things go wrong. And is that placing a statutory duty of candour on an individual? I am not sure that it is. It is the outcome that I'm focused on. The mechanism to get there is not something that I am yet clear about. And I remind the member again that DHSC in England is reviewing the duty of candour because it's clearly not delivering exactly as it was. I was studying not that long ago a comparative report into candour in aviation and in health. And the conclusion seemed to be that aviation was way ahead of the health service. But because of the black boxes, because of the fact when a catastrophic event occurs and passengers die, that every effort is made to analyse what went wrong through the black boxes, etc., with no particular concern for, in fact, on the individual. But of course the point is, if there's a catastrophic impact in aviation, the pilot and the crew tend to die, whereas in the health service it's the patients who suffer rather than those working in it. So you have to have a concern about what system do you put in place which most motivates an individual to come forward and be honest about the mistakes they have made. And you could put a punitive system in place which actually discourages openness and candour.
Dr. Steve Aiken.
Minister for his answers so far. Can the Minister provide an assessment of the impact that the budget 24-25 has on its ability to deliver pay awards in the 24-25 period?
Minister.
And I thank the member for his question. It's simply not good, is the short answer to Mr. Aiken. The budget I have gives me frankly zero ability to deliver a pay award for this year. Members will know we're largely informed by the recommendations of various independent pay review bodies, and while those panels are yet to publish their recommendations, they're likely to come in just a few weeks' time. Now, a pay award here of 3% will cost approximately £150 million. And while there was an additional allocation of resource in the most recent budgetary outcome, not a single penny of that, I'm afraid to report, was for pay. And if I may broaden out, Mr. Speaker, pay is part of what I consider to be a definition of a good job. And I'm very pleased that my ministerial colleague, the Minister for the Economy, Conor Murphy, has charged Dr. Lisa Wilson from the Nevin Economic Institute to look at a definition of what a good job is. And that's something the Economy Committee, I know, is looking at. And I would like every job in health and social care to be a good job. And pay, yes, pay is very important. Terms and conditions are very important. But I see a good job as a job that people get out of bed because they want to go and look forward to their shift, that it's a valued role, that they think it's important, but importantly in health and social care, that we all value the work that is being done. And unfortunately, I can only repeat that in terms of pay, there is a shortfall potentially of £150 million if we were to talk about a 3% increase this year.
That brings to a conclusion topical questions to the Minister for Health. Jim Allister has given notice of an urgent oral question to the Executive Office. I would remind members that if they wish to ask supplementary questions, they should rise continually in their places. The member